One of the commonly done procedures at our hospital is HSG or the hysterosalpingogram. So when is it done? It's usually done within the first 9 days of the start of the menstrual period, and it's done in the X-ray room, and it's usually done as an outpatient procedure. This procedure is not very costly, it's inexpensive rather, and it does not require the administration of anesthesia. In this procedure, we inject a dye through the cervix into the uterus, and the dye comes out through the fallopian tubes, and at the same time we do an X-ray. Once the X-ray is done, we assess the X-ray film to know the patency of the tubes, that is whether it is open or it is closed. Another added advantage in this procedure is, as the dye outlines the uterine cavity, we also get to know if there are any anomalies or any problems in the uterine cavity. One of the main problems in this procedure is, if the dye is not seen on the X-ray film, it cannot be assumed that the tubes are blocked. That is, the procedure is not 100% sure when the tubes are blocked. This is often enough because there is spasm occurring, probably due to pain. So, mostly we also tell the patient beforehand about such problems. So, the patient can also choose from another procedure, that is a diagnostic laparoscopy with a hysteroscopy. In this procedure, we put a small camera through the abdominal wall, and we see the pelvic structures. So we can assess the uterus, the tubes and the ovaries, and at the same time we can push the dye through the cervix, and we can see the dye coming out through the tubes on the camera. So this is like in a live way we are seeing the dye coming out, and we are 100% sure that the tubes are open. And the added advantage in this procedure is, in the same sitting we can also do treatment if there is any blocked tubes, that is hysteroscopic tubal cannulation can be done. Another thing is, if there are any other problems, like if there is endometriotic cyst, we can do a cystectomy in the same sitting. If there is polycystic ovaries, we can do ovarian drilling in the same sitting. If there are adhesions in the pelvic area, we can do adhesive lysis. And we not only get a diagnosis, we also do the treatment in the same sitting. The one main drawback in this is the cost, the need for anesthesia, and the need for admission in the hospital, probably for 1 day, but still it's an admission. So both the procedures are explained in detail to the patient, and they can choose from any one of the procedure after being informed of all the advantages and disadvantages. These both procedures are being offered in Barka branch of Badr Samaa. Thanks for listening to me.